Hey guys, Dr. Ben here, Functional Medicine Centers. So glad that you're on today because this information is amazing and exciting and something that everybody needs to know about, because this is just one of the simple things that people can reverse and repair, and that is diabetes. We see it all the time with patients, and we're talking type 2 diabetes. They used to call it adult onset, but guess what? We're seeing insulin resistance in kids, in teenagers, pre-diabetes all over the place. So a patient came in, 66 years old, in December, came in. He was overweight, over 300 pounds. His A1C is going to be the average of the last 3 months of somebody's blood sugar. It was 7.2. 7.2, anybody out there that knows A1C, that knows blood sugar, full-blown diabetes, no doubt about it. 5.9 is our cutoff for diabetes. 5.7 is the cutoff for pre-diabetes. 5.2 is a perfect number. He was 7.2, full-blown diabetic. He was on statins, all types of different medications. We started going through the process, started monitoring the blood sugar, working on the liver, working on the gut, all these different things. He went from 7.2 to in December into March, 1st of March, he was 5.9, so still right at that cutoff. And then he just ran blood work again last week with his primary care doctor, and he's 5.6. He was hoping to get a full-time continuous glucose monitor, but couldn't because his doctor was like, you know what, I can't justify the insurance paying for this because you're not even pre-diabetic anymore. On top of that, he was down 80 pounds since December. His body was just like, sweet, I don't need this. I don't want to hold on to this weight anymore. He camps, fishes, hikes, all this stuff. Think about the difference this summer is going to be for him to be 80 pounds down and to be able to go and hike and bike and camp and do all these things that he wants to do. So this is totally possible. People can reverse their diabetes. All the time we see it. They put the time in, the energy in, and they're able to get their life back. Like I always say, if somebody does what they need to do and if they play the game, they're going to get the results that they need. But then on the other side, if they go back and do what they've always done, they're going to get the same result. So if he stays consistent, if he does what he needs to do, he will see these long-term benefits. His fatty liver markers, his GGT, cut in half, and he's reversing his fatty liver. All of these different things are changing because of what he's doing, because of what he's putting into his mouth and not putting into his mouth. He's learned what works and what doesn't. So if you or a loved one are dealing with high blood sugar, pre-diabetes, diabetes, blood sugar imbalances, anything like this, absolutely, you've got to jump on. You've got to start the process to get your life back. Open up in Nashville, Tennessee next month. We do work with patients all over the country. Just had a family fly in from Illinois this week, Wyoming, Nebraska, all over the place. So drop us a line if you got any questions, but tell people about this, motivate them, tell them they can get their life back, and they can see miracles all the time. Good to see you guys. Make it a great day.